some hand sanitizer and clean my hands. And I'll start off by introducing myself. So, hi Erin, I'm Taylor. I'm a student nurse at St. Francis, and I'll be helping take care of you today. Before we get started, are you having any pain?
No.
Okay, if you could rate your pain on a scale of 0 to 10, what would you rate it?
0.
0? Okay. So we'll get started with your assessment. So first I would take her vital signs, which is pulse, count her respirations, and her blood pressure. And then after I do that, I'll take a listen to her. So I'm going to start with your heart and your lungs, and then we're going to listen to your abdomen for your bowel sounds, okay? So I'll listen to the 5 spots on her heart and lung sounds bilaterally, and then the 4 quadrants on her abdomen. And we're looking for active bowel sounds in all 4 quadrants. And then next I'll ask her some questions about her breast. So are you having any tenderness or engorgement with your breast right now?
No.
No? Are your nipples cracked or bleeding at all?
No.
No? Okay. Well, if you do have any cracked or bleeding nipples, you can let us know about those, and we can get somebody in here to help you with that. And with the engorgement, we do offer cabbage leaves on the floor, and those can really help with reducing the swelling and engorgement of your breast, okay? And then next I'm going to move to her uterus, and I'll use a 2-handed technique, and I'll support the uterus at the bottom, and I'll find the fundus at the top. And we're feeling where the uterus is at, and for the sake of this video, we'll say that Erin's is 2 finger breaths below the umbilicus, and it's firm in midline. And if you do notice that your uterus is feeling boggy or not so firm, or you're having extra bleeding on your pad, you can go ahead and massage your uterus about once an hour, and that can help reduce the bleeding, and that can reduce your risk for hemorrhage as well. So next I'm going to ask her about her bowel and bladder habits. So I'll ask have you been passing any gas since you've delivered?
Yes.
Okay, that's good. Have you had a bowel movement since delivery?
No.
Oh, that's completely normal. If you can get up and try to walk a couple times a shift, or if you can increase your fluids, or we can give you a stool softener that can also help you get a bowel movement going. Have you had a void, or have you urinated since you've had your baby?
Yes.
Okay, that's good. We want to see that. Are you having any burning, or is it painful when you do go to the bathroom?
No.
Okay, that's good. Any signs of that can mean you have a UTI, so we really want to watch for that. So if you do notice any of that, you can let us know, okay? And then next I'm going to check her loci on her pad. So I will pull the pad up, and I'll look for the color, which in the hospital we should be seeing red rubra color. And I'll note the amount and if there's any blood clots, and it shouldn't smell an odor, but if we do, we'll also note that. And we can educate our patients on if you're seeing filling a pad an hour, that is 1 phone call to your doctor, because that's too much blood. You shouldn't be having you shouldn't be having a full pad an hour, because that's considered heavy bleeding. We want it to be more moderate to scant bleeding. So any of that, especially when you're at home, you can call your physician, or you can just sit down and rest so that you don't have too much activity with your bleeding, okay? Okay, and then next I will check her episiotomy on her bottom. So I'll have her roll on her side, and we'll use RETA, which is redness, edema, ecchymosis, drainage, and approximation. So we'll check the episiotomy if she does have one, or just the perineum in general. And this is a time where if she had a spinal or an epidural, can look at the spot on her back as well. And this is the time to check if she has any hemorrhoids, and she doesn't have any right now, so that's a good sign. So then we'll have them roll back over, and then I'll assess her legs for her DVT risk. And so I'll check for redness, swelling, and warmth in her legs, and then I'll ask her, are you having any calf pain right now?
No.
Oh, okay, that's good. If you are having any calf pain, or if you do notice any of those 3 signs, which was warmth, swelling, or any redness in your legs, then that's a sign that you could have a blood clot in your legs. We want to make sure we get that taken care of, because that can put you at increased risk for some things, okay? Okay, and then now I would state my patient's emotional state. So it looks like she's coping with her delivery very well. She's not having any anxiety, or she's not crying or anything, which is a good thing. So that's some things we want to see, and we just want to check on that every time we go into the room and make sure there's no change in that. And then if my patient had a C-section, I would check her IV site on her arm, and I would make sure that there's no redness or swelling or pain with that. If she has any of that pain, then we can look at changing the IV site, or if it's time to take it out, we can do that as well. And then I'll look at her incision on her abdomen and make sure that it's healing properly. There's no extra drainage or bleeding that we don't want to see. And then if she had a Foley catheter placed, we'll if it's still in place, we'll check that out, and if not, then we'll keep continuously watching her for symptoms of a UTI. and make sure her output is what we want to be seeing. So that is my assessment on Mom.